Good evening. Welcome to South Asia Newsline. I'm Yeshi Chanzam. Here are the top stories we are tracking for you on Monday, the 10th of May. India sees minor dip in new COVID-19 cases below 400,000. States undergo strict lockdowns. Taliban declares 3-day ceasefire for Eid celebration in Afghanistan. And Muslims in Bangladesh, Pakistan throng Ramadan markets amid surge in coronavirus cases. And now for all the details. India on Monday registered a minor dip in both daily new COVID-19 cases at over 360,000, and that's below the 400 mark in the past 24 hours, said the Health Ministry. This comes as over 170 million vaccination doses have been administered across the country since January, when India kicked off a nationwide vaccination drive.
India on Monday reported 366,161 new COVID-19 cases, the first time after 4 straight days that the country has seen less than 400,000 new cases. As per the Health Ministry data, the country recorded 3,754 deaths in the last 24 hours, taking the death toll to 246,116. In the wake of the COVID-19 situation, capital New Delhi has been put under a third successive lockdown till May 17, while a number of school exams have been cancelled or postponed.
I think it's a good step. अच्छा है because lockdown है तो वैसे भी people should stay at home. Essential workers के लिए दिक्कत होगी, maybe उनके लिए start कर सकते हैं, but general public के लिए नहीं होनी चाहिए.
Other than New Delhi, many other states have also imposed strict lockdowns over the last month, while others have placed curbs on movement and shut cinemas, restaurants and shopping malls. Police personnel were seen beating violators and seizing their vehicles in southern Karnataka state on Monday. This comes as India is trying to vaccinate as much citizens as it can amid the surge in virus cases. Over 170 million vaccination doses have been administered across the country since January, when India kicked off a nationwide vaccination drive. Online registration began last week for vaccinating people aged above 18.
Himanta Biswa Sarma took oath as the 15th Chief Minister of Northeastern Assam State along with 13 members of his cabinet on Monday after he was elected unanimously by India's ruling BJP Legislature Party, which met in Guwahati on Sunday. Sarma has been credited as the man behind the BJP saffron surge in northeast India. Himanta Biswa Sarma was sworn in as the new Chief Minister of Assam along with 13 members of his cabinet on Monday amid restrictions in place due to the pandemic in Guwahati city. Sarma, who was the charioteer of India's ruling BJP Bharatiya Janata Party stride in the northeast, was administered the oath in presence of State Governor Jagdish Mukhi, the BJP National President JP Nadda and other leaders. Former Chief Minister Sarbananda Sonowal, who himself had proposed Sarma to succeed him in the legislators' meeting on Sunday, however, has confined himself to the roles of a legislator. Indian Prime Minister Narendra Modi congratulated Sarma and said he was confident this team will add momentum to the development journey of Assam. In another tweet, Prime Minister also thanked Sonowal for his contribution towards Assam's progress and strengthening the party in the state. In the results announced for the 126-member Assam Assembly last Sunday, the BJP won a second straight term with 60 seats, while its alliance partners AGP Assam Gana Parishad got 9 seats and UPPL United People's Party Liberal 6. Moving on, Pakistan on Monday reported 3,447 new infections of COVID-19 in the last 24 hours, taking the cases tally to over 861,400. People are rushing in huge numbers to get inoculated amid the third wave of coronavirus. Authorities in Sindh province have said after May 16, vaccinations will be also available to those under the age of 40.
Pakistan on Monday reported 3,447 new infections of COVID-19 in the last 24 hours, taking the cases tally to 861,473, with 18,993 deaths so far. Meanwhile, Pakistan's vaccination campaign has intensified in recent days, with people rushing in huge numbers to get vaccinated amid the third wave of coronavirus in the country. The health department in Sindh province has said that after May 16, COVID-19 vaccinations will be available to those under the age of 40. However, authorities under new guidelines have restricted use of the AstraZeneca vaccine among people under 40 years of age.
इस बीमारी का कोविड-19 से अगर छुटकारा पाना है अपने आप को वैक्सीन कराना ज़रूरी है। अल्हम्दुलिल्लाह ये वैक्सीन भी आ गई है और ये दूसरी तीसरी लहर भी आई हुई है जो बड़ी ख़तरनाक होकर इंडिया में आई हुई है, जो KPK और पंजाब में पहुंच चुकी है। अगर इससे हमने छुटकारा हासिल करना है तो पब्लिक को अपने आप को वैक्सीनेट करना होगा और तमाम SOPs पे अमल करना होगा।
Authorities in Pakistan imposed complete countrywide lockdown from May 8 for the next 10 days. Officials are worried the country's healthcare system, already under strain, could reach breaking point if more contagious variants of the virus begin to spread. The government has planned stricter restrictions on movement and gathering in public ahead of the Eid festival.
In news from Afghanistan, Taliban insurgents on Monday said they would observe a 3-day ceasefire in Afghanistan for the Muslim religious holiday of Eid starting this week, after weeks of increasing violence that gripped the country. This came 2 days after bombings outside a school in the western part of the Afghan capital killed at least 68, most of them students, and injured more than 165 others.
Mohammad Naeem, a Taliban spokesman, on Monday took to Twitter and said the insurgent group will observe a 3-day ceasefire in Afghanistan for the Muslim religious holiday of Eid starting this week after weeks of increasing violence that gripped the country. Naeem said the group's fighters had been instructed to cease all military operations against the Afghan government, but added they were ready to retaliate if attacked by the government forces. The ceasefire declaration came 2 days after bombings outside a school in the western part of Afghan capital Kabul killed at least 68, most of them students, and injured more than 165 others. No group claimed responsibility for the attack. Taliban insurgents fighting to overthrow the Afghan government since their ouster by US-led forces in late 2001 denied involvement in the bombings and condemned them. Afghan government leadership said the group was behind the attack. President Ashraf Ghani declared Tuesday as a national day of mourning for the victims of the Kabul and Logar bombings. Meanwhile, Abdullah, the chairman of the High Council for National Reconciliation, in a statement on ceasefire announcement by Taliban said the temporary ceasefires are not permanent solution to the country's problems, stressing the need for permanent ceasefire to end the war in the country. Peace talks between both warring sides in the Qatari capital Doha, which began last year, have made no progress and violence has risen. Kabul has been on high alert since Washington announced plans last month to pull out all US troops by September 11, with Afghan officials saying the Taliban stepped up attacks across the country following the announcement.
In news from Nepal, Nepal's COVID-19 cases tally has reached over 394,600, while Kathmandu Valley continues to witness a record high daily rise in infections. The fresh wave has seen a shortage of hospital beds and medical supplies across the country.
Nepal on Sunday reported 8,777 cases of coronavirus infection, taking the nationwide caseload to 394,667, with 3,720 deaths reported so far. Kathmandu Valley witnessed a record high daily rise in coronavirus infections with a total of 4,198 new cases on Sunday. The capital city recorded 3,161 new infections, Lalitpur district 533 and Bhaktapur 504 cases. With too many COVID-19 dead to cremate, officials in Kathmandu were busy creating space on the river bank as funeral pyres blazed nearby over the past weekend. The crematorium near the Pashupatinath temple, the biggest Hindu temple in Kathmandu, has been overflowing with the family of the dead as workers in makeshift PPE kits swiftly made preparations for the cremations.
यो दिनकै कोरोना बढिरहेछ घट्ने क्रमै छैन बढेको बढै छ मृत्युहरु त्यतिकै भइरहेका छन् मान्छे मरिरहेका छन् अब तनाव भइरहेको छ अब यो रोगीहरु बढिरहने मृत्यु पनि मान्छेहरु धेरै मरिरहने हुँदा नि के गर्ने भन्ने तनाव भइछ कसरी सुरक्षित बस्ने हामी भन्ने तनाव भइरहन्छ.
Nepal's major cities and towns have been under a lockdown since last month, and authorities stopped both domestic and international flights last week. The new wave of coronavirus infections, which has spilled across the Indian border into Nepal, has seen a shortage of hospital beds and medical supplies across the country.
Moving on, people in Bangladesh and Pakistan rushed to markets to buy supplies ahead of Muslim festival of Eid al-Fitr amid coronavirus pandemic. Ahead of Eid al-Fitr, Muslims buy new clothes and food to celebrate the festival.
Pakistanis rushed to markets to buy supplies for Eid al-Fitr after the government said a week-long partial lockdown would be imposed from May 8 as coronavirus cases surge. According to the order, which will be in effect until May 15, all markets, businesses and shops will remain closed except essential services like grocery stores, pharmacies, petrol pumps as well as home delivery. The announcement of the upcoming lockdown brought shoppers out into the markets, creating crowds at markets.
मार्केट में तो काफ़ी रश है माशाल्लाह से कारोबार जो है माशाल्लाह बहुत अच्छा है और लोग एहतियात नहीं कर रहे लेकिन माशाल्लाह काम ज़्यादा है लोगों को पता चल गया है कि लॉकडाउन लगने वाला है तो मार्केट में आवाम बहुत ज़्यादा निकल आई है और एहतियात SOPs पर तो अमल भी नहीं कर रहे एहतियात नहीं कर रहे लोगों को बहुत समझाया कि मास्क पहने डिस्टेंस रखे लेकिन कोई डिस्टेंस नहीं कोई मास्क नहीं.
Similar scenes were witnessed in neighboring Bangladesh's capital city of Dhaka, where locals thronged busy and crowded Ramadan markets to shop for bargains, despite social distancing measures and a lockdown being in place on Sunday. Ahead of Islam's biggest festival, Eid al-Fitr, many Muslims in Bangladesh were rushing to buy new clothes and food to celebrate, with many crowding cheaper street markets this year due to the coronavirus pandemic hitting their wallets.
An engineer in India's southern Hyderabad city has developed a new, more affordable oxygenator for COVID-19 patients in home isolation or those who are unable to get a hospital bed. The portable device, which uses hydrogen peroxide as main component, can produce oxygen for about 12 hours. An engineer in India's southern Hyderabad city has developed a new, more affordable oxygenator for COVID-19 patients in home isolation. The project has been inspired by a school experiment where metal oxide is used with hydrogen peroxide in a decomposition reaction, which further breaks down into water and oxygen. The portable device uses a microreactor and catalytic bed and also has an inbuilt heat exchanger to prevent overheating. In one go, it can produce oxygen for 12 hours and cost 1/40th as much as an oxygen concentrator.
Basically, as a chemical engineer myself, I felt like I have to step up and try to develop some kind of solution where the oxygen can be delivered to the patients at home isolation during the emergency conditions. We all know that the oxygen cylinders are there, and so is the oxygen concentrators. We have it available at multiple places, but especially for the lower and middle income groups, affording a oxygen concentrator is not that viable.
Indian hospitals and home isolators have complained of lack of oxygen over the past 1 month with rising cases of coronavirus. Some reports of black marketing and hoarding have also come to light. Well, that's all we have for you from South Asia this evening. Now our viewers can watch the show on SouthAsiaNewsline.com. You can also visit us on Facebook.com/AsAsiaNewsline and follow us on Twitter @AsAsiaNewsline. That's all in tonight's edition. We will see you same time tomorrow. Good night.